This is the model of larynx. Larynx or voice box, which is the part of the upper respiratory tract, extending from the third cervical vertebra to sixth cervical vertebra. It lies on the anterior compartment of neck. The larynx, it has got paired cartilage. Actually, it is made up of cartilage and membranes. There is no bony framework, only cartilage and the membrane, and inside it is wrapped around by the mucous membrane. The cartilages of the larynx, they are paired and unpaired. There are three unpaired cartilage. Those are, this is the thyroid cartilage, this is cricoid cartilage, and this is epiglottis. This is epiglottis in red color. It is a leaf-like cartilage, unpaired cartilage. It lies just behind the tongue, posterior part of the tongue. It has got broad lamina above, and below there is a narrow stalk. It adheres with the thyroid cartilage along the superior thyroid notch, and in front of the epiglottis, this yellow one, there is a fatty space, fatty tissue which lies in the pre-epiglottic space. So this is epiglottis, which is leaf-like. There are hyaline cartilage and fibroelastic cartilage. Hyaline cartilage is cat, that is hyena. Hyaline cartilage, hyena look like cat. So hyaline cartilage are three, that is the cricoid cartilage, arytenoid cartilage, and the thyroid cartilage. Cat. Arytenoid cartilage except the apices of the arytenoid cartilage, and rest cartilage of the larynx are fibroelastic cartilage. Hyaline cartilage are those cartilage which calcify at the age of 20. Okay, now coming to the unpaired cartilage, this is the first one, the epiglottis, which I have discussed. Now this is the thyroid cartilage. It is a quadrilateral lamina, both side, which is attached, and the cranially it is separated to form the superior thyroid notch, and inferiorly it create a prominence which is called the laryngeal prominence or Adam's apple, and it has got superior cornu and the inferior cornu. Here is also superior cornu, white color, and the inferior cornu. And there is one oblique lamina which extends from the superior tubercle to inferior tubercle and presents a site for the muscular attachment. Superior cornu faces the backward, upward, and laterally, whereas the inferior cornu, it is towards the inferior aspect and medially and backward. So this is our thyroid cartilage. Now the next unpaired cartilage is cricoid. Cricoid means signet ring-like. It is a ring-like. Anterior portion is narrow, whereas the posteriorly it is broad in green color. This is the cricoid, broad and forms the lamina. This is anteriorly, this is thin, this is narrow, which is called the arch, cricoid arch, and posteriorly it is broad and quadrilateral, and this is cricoid lamina. Okay, these are three unpaired one. Now paired are this in red color, this is arytenoid cartilage. Arytenoid cartilage, just look at here, This is arytenoid cartilage, which is here, lies on the top of the cricoid lamina, on the lateral aspect, posterolateral aspect. Okay. Now coming to the arytenoid cartilage, it is pyramidal shape. It has got three surface. That is the, in red, this red one, this is the anterolateral surface. This is the, in green, this is posterior surface, and in blue, this is the medial surface. And this yellow one is the, just above the arytenoid, this is the corniculate cartilage. Corniculate, which is horn-like. Okay. So this is, yellow one is the corniculate cartilage, and this is the pyramidal shaped arytenoid cartilage. It has got two process, the anteriorly, infero-anteriorly, this is vocal process, and infero-laterally, this is the muscular process. Okay. So this is corniculate cartilage, and this is cuneiform cartilage. Just above the corniculate cartilage, this is vase shaped, and it lies on the margin of the thyroid membrane. This is thyroid membrane, ariepiglottic fold, not thyroid. It is ariepiglottic, that is connecting the ari, means arytenoid, and epiglottis, ariepiglottic fold. This is, I made it with the transparent polythene, so that everything should be visible all throughout. So this is cuneiform cartilage. And sometimes there is also trapeziate cartilage, which lies on the, just above the superior cornu of the thyroid cartilage here, in the thyroid membrane. Okay, trapeziate or tritiate cartilage. So this is all about the cartilage. Now coming to the membrane and ligament. The membrane, these are the fibrous structure. If this is thin, this is called membrane. If this is thick, it is called ligament. There are extrinsic membrane and the intrinsic membrane. Extrinsic, that all these cartilages which I have mentioned, these are the cartilages of the larynx. If the membrane is attaching with these cartilages with the adjacent structure, that is called the extrinsic membrane. And if the membrane is restricted to the above mentioned, which I have mentioned, cartilages, restricted to the cartilages of the larynx itself, then it is called intrinsic membrane. So what are the intrinsic and the extrinsic one? This is the extrinsic, because it attaches, this is the hyoid bone, in white color, this is the hyoid bone. This is the lesser cornu and the greater cornu. Okay, the lesser horn or lesser cornu, lesser horn of the hyoid bone, and this is the greater horn. In between the hyoid and the thyroid, this is thyrohyoid membrane, which has given this gray color border. This is a polythene. Okay. So this is extrinsic, because it attaches the cartilage of the larynx with the adjacent bones or cartilage. Okay, so this is thyrohyoid membrane, these are the extrinsic, and this is also extrinsic, that is the cricotracheal ligament. This is the tracheal rings, this black one, the first tracheal ring, second tracheal ring, this is C-shaped. Okay, so in between the upper border of the first tracheal ring and the lower border of the cricoid, that this green one, there is a membrane which is called the cricotracheal membrane. Okay, so this is also extrinsic. And now coming to the intrinsic are, this is the cricothyroid membrane. This is the cricoid cartilage and this is the thyroid cartilage. In between these two, this is cricothyroid membrane, and the middle part of the cricothyroid membrane is thickened to form the cricothyroid, median cricothyroid ligament. Thickened part is called ligament. Okay. Now another intrinsic one. This is the Oriepiglottic fold. Ari means arytenoid, epiglottic means epiglottis. In between these two, this is the Oriepiglottic fold having I've taken this, put this gray margin wire. Okay, so this is Oriepiglottic fold. This is also known as quadrangular membrane, as it is quadrangular here and also here. So this is the intrinsic, because it attaches the two cartilages of the larynx, and inside there is a fibro in the which forms the inner framework of whole of the larynx, is a fibroelastic membrane just outside the mucous membrane but inside the muscles and the cartilage. There is a fibroelastic membrane. Okay. So, and now what is this space? This is very important, clinically significant. This is the pyriform fossa. Pyriform fossa, it is bounded anteriorly by the thyrohyoid membrane. This is the hyoid. This is the hyoid and this is the thyroid. Thyrohyoid membrane anterolaterally, and this is anteromedially Oriepiglottic fold. Oriepiglottic fold. This is the space. Here is also polythene. Here is also polythene. So in the laterally, anterolaterally, this one is the thyrohyoid membrane, and here anteromedially this is Oriepiglottic fold, and posteriorly it is continuous with the pharynx. Okay, and this is called the pyriform fossa or a smuggler fossa, because a smuggler used to keep the precious things here. Okay, and this is also common site for the impaction of the foreign body, most commonly the face bone. And the most another clinical significance, that this is the suppose this is the thyroid gland and it lies like here, and so the infection of the pyriform fossa travel to the thyroid gland also. This is the thyroid gland which lies with the lateral aspect, and the pyriform fossa is the infection communicated to the thyroid gland. So this is also clinically significant. So this is about the membrane. Now coming to the muscles of the larynx. They are the, this one is the cricothyroid in green color. This is the cricothyroid muscle. It has got attachment over the cricoid arch. This is in green color. This is the cricoid arch. So it has got attachment over the cricoid arch and insert over the thyroid cartilage. The lower part of the thyroid cartilage as well as the inferior cornu. Okay, and those are the impaired, okay, cricothyroid muscle. Now what next? This is the lateral cricoarytenoid. It originates from the lateral part of the cricoid arch and going to the muscular process. This is the muscular process. This is the, in the lateral side, this is the muscular process, and anteriorly this is vocal process. Anteriorly this is vocal process. So on the lateral aspect there is muscular process, and this lateral cricoarytenoid from the lateral aspect of the cricoid arch to the muscular process of the arytenoid. Okay, lateral cricoid. This is in orange color. This is the posterior cricoid from the posterior aspect of the cricoid, that is from the cricoid lamina, and going to the muscular process of the arytenoid. This pink color, this is the oblique arytenoid, extending from the muscular process of the arytenoid going to the epiphysis of the arytenoid, both sides, like an axe. And this in green, this is the transverse arytenoid, connecting the two arytenoid transversely. Okay. Now what next? This is the in yellow color, this one. This one is the thyroarytenoid, that it connect anteriorly with the, in white color, this is the thyroid cartilage, thyro, and posteriorly with the arytenoid. So thyroarytenoid muscle. Okay. One thing worth mentioning, that only abductor, PAB, that is the posterior cricoid. This one in orange color, this is the only abductor of the vocal cord. Okay, and cricothyroid, this tenses the vocal cord, and the rest are relaxes the vocal cord. Okay. Now come to the nerve supply. It is supplied, now you can see also the posterior, in the interior aspect, that this is the vocal cord inside. This is the, I made only of one side, not another side, so that the interior of the larynx should be visible. This is the laryngeal, this is the ventricle of the larynx. In between the this is vestibular fold, and this is vocal fold, or you can say false vocal cord, and this is true vocal cord. In between these two, there is a space which is called ventricle of the larynx, and anteriorly it is communicated with the saccule of the larynx, which provide mucus secretion so that these areas should not be dried. Okay. Now coming to the nerve supply, that the larynx is supplied by the superior laryngeal nerve and the inferior laryngeal nerve. This is the vagus nerve in blue color. This is the vagus nerve. Vagus nerve, when descend down through the middle compartment of the jugular foramen at the level of the neck, it gives two branches, that is the superior laryngeal nerve and the inferior laryngeal nerve. Superior laryngeal nerve shown with the green wire, and the inferior one by the grey wire. Inferior laryngeal nerve, what we are seeing, that is very much long. It descends up to the sternal angle, where it arches hooked around in the right side with the subclavian artery, and in the left side with the ligamentum arteriosum. Ligamentum arteriosum is what? Is the remnant of the ductus arteriosus. Ductus arteriosus is a communication between the right pulmonary artery and the arch of aorta in the fetal age. So, in the right side, this inferior laryngeal nerve hooked around, inferior laryngeal nerve, as it takes again the recurrent course, that's why also known as recurrent laryngeal nerve. So, in the right side, it hooked around the subclavian artery, and in the left side, it hooked around the ligamentum arteriosum. And now, it take reverse course and then supply the larynx. So, this green one is the superior laryngeal nerve, and this is the inferior laryngeal nerve. Superior laryngeal nerve again divided into external laryngeal nerve. This is the internal laryngeal nerve, and this is the external laryngeal nerve. External laryngeal nerve supply cricothyroid muscle, and internal laryngeal nerve, it pierces the thyrohyoid membrane and supply the internal aspect, mucous membrane of the larynx, but supraglottic part only. So, it is motor to the cricothyroid. Superior laryngeal nerve is motor to the cricothyroid and sensory for the upper half of the mucous membrane of the larynx. Whereas this gray one is the recurrent laryngeal nerve, it supplies rest of all the muscles except this cricothyroid, which is supplying by this external branch of the superior laryngeal nerve. And this is the recurrent laryngeal nerve, which is going to supply rest muscles. Okay, and the internal aspect, that is the sensory for the lower half of the larynx. Okay, and one thing very worth mentioning about the recurrent laryngeal nerve palsy, that if it is unilateral, then opposite side recurrent laryngeal nerve compensate for that. And if there is a bilateral recurrent laryngeal nerve palsy, if this is complete bilateral, then the vocal cord remain in between the adducted and the abducted position. So patient can take respiration. There will be difficulty in phonation, but the patient take respiration. Patient will be alive. But if there is partial paralysis of recurrent laryngeal nerve, the vocal cord remain in adducted position. That is, the both margins are approximated. So the patient cannot respire, respiration. So the partial paralysis of the recurrent laryngeal nerve is very dangerous comparative to the complete paralysis. Very important. Okay. Now coming to the artery, the larynx is supplied by the superior laryngeal artery and the inferior laryngeal artery. Superior laryngeal artery is the branch of the superior thyroid artery, which itself a branch of external carotid artery. Whereas the inferior laryngeal artery is the branch of inferior thyroid artery, which is the branch of thyrocervical trunk, which is the branch of subclavian artery. Okay. So this is all about the laryngeal anatomy. Okay. Thank you.